salivary glands, it can be major or minor. Under major, you have three pairs of salivary glands. These are pair of parotid seen here, mandibular, one here and one on the other side, sublingual, which is seen just under the tongue in the floor of the mouth. I'll show you a picture so that you can understand better. Parotid, submandibular and sublingual. So in this salivary glands, major salivary glands or even minor salivary glands, there are thousands of them in the oral cavity and even in the oropharynx. So in the salivary glands, we have so many numerous diseases or even malignancy. Under malignancy, the most common one is mucoepidermoid carcinoma. So that is the topic for today. So this topic I split into two, part 1 and the part 2, which will be dealt, only the main operation will be dealt with in the part 2, rest in part 1. So this mucoepidermoid tumor is seen mainly in the parotid gland. So as such, the total parotid gland malignancy, this comprises approximately 5% and mainly seen in the parotid gland. It's more common in males, and if you ask me the age group, it is between 40 to 50. Now coming to the types, you have two common types in this. One is low grade and the other one is high grade. This mucoepidermoid tumor, it is considered to originate from the excretory duct of the salivary gland. So the term, if you see, mucoepidermoid, because you have two words put together, because it has got a mucous cell component and it has got an epidermal cell component. The first one, mucoid, it secretes mucus. The second one consists of solid cells clustered together. So the terminology mucoepidermoid tumor. Now coming to the presentation. The common complaint of the patient will be, they will be saying they have been having that swelling in this region for a long time, and now it has started increasing suddenly. Usually it is painless, or slight more than pain, we can say discomfort will be there, and the swelling is increasing in size. This is for the early presentation. Suppose it is late presentation, in that case they will present even with facial nerve palsy, because the facial nerve, it traverses through the parotid gland. Now if suppose the presentation is late, since the mucoepidermoid carcinoma has a tendency to metastasize, there is a high possibility they can present along with this swelling, they can present with the neck swelling too. There is a cervical lymphadenopathy, lymph node secondaries. So on examination, there will be a definite swelling which is hard, slight discomfort, demarcated, maybe mobile or not, or maybe it is fixed depending upon the stage, and there will be no warmth over the swelling. There will be swelling, but skin above the swelling will be normal in the early state and will be tethered in the late state. The mass will be stuck to the skin. That means it has spread to the skin during the late stages. And the neck examination, it may reveal that there is lymphadenopathy also, indicating metastasis. Coming to the investigation, to start with, we need ultrasonography. The report will be issued immediately. In that, we will come to know that most probably it is going to be malignancy. To be followed with, we need to do a fine needle aspiration cytology for the same radiologist, and he'll put in a small needle, take out the cells, send it for testing, and the report usually is available by the 3rd day or the 4th day. So the diagnosis is confirmed. Now we know it is mucoepidermoid tumor and it is of low grade or high grade. About the treatment. So since the treatment the preliminary treatment, the basic treatment is surgery, we need to have imaging too. So either we can do CT scan or we can do MRI scan. So if you ask me which is better, the MRI scan will be better. Now, if in case there is a suspicion of metastasis, it's better that we get PET scan also done. PET means positron emission tomography, which gives us an idea whether the tumor has spread from here, metastasized from here to different parts of the body or not. Now, the investigation part is complete. The basic investigation related to diagnosis is complete. The other investigations which is related to the surgery, I'll tell you in the second part. Now, whether it's low grade or high grade, the basic necessity is surgery, which includes parotidectomy, and as far as possible, preservation of the facial nerve. Now, in case of high grade tumor, it is going to be really difficult to preserve the facial nerve. Now, I'll please go through the second part of mucoepidermoid carcinoma parotid, so that you understand about the preparations to be done for the surgery and what all you can expect from the doctor in the hospital, and the post-operative care, what all things to be done at home, what all things not to be done at home, and in case it's high-grade tumor, what is the next line of management. This I'll deal in the second part. Thank you so much.